So I think we're ready to go. Good morning, everybody who's online. I hope you can all hear fine. If you have any problems hearing, please send us a message, but otherwise I think we're good to go. We've had an extraordinary number of people indicate they're going to attend. I don't think everyone's online, but there's an awful lot of information to get through. So I'm going to start and hopefully we'll have a good time for discussion at the end of the presentation. So I'm sure all of you are budget tragics like our staff here at ACSA, and we were in Canberra obviously on Tuesday to see what the budget revealed. It's been an interesting couple of days since, as we've tried to work through exactly what some of the figures are, and I'm going to go through those for you. I think it's the real value add we can add today. I'm going to go through a PowerPoint presentation, so you won't see me, you'll be spared that, and you'll have the slides and we'll work it through, and then we'll come back for a Q&A. So we'll just get the slides up so that we can take you through those. So here we go. This is our 2018-19 budget special edition. Those of you who are ACSA members would have received on Tuesday night a copy of our budget overview and update. These are some of the key measures we'll be discussing today. So the increasing number of home care places, the fact that they're high-level home care places, 146 million for rural and remote, the 83 million for mental health services, particularly pleasing for us as that has been one of ACSA's lobbying points, the prevention of elder abuse, and interestingly the pension loan scheme and pension work bonus, which actually particularly the loan scheme will give people options around how they pay for their aged care. So the headline and the funding, which we need to get straight because there's been lots of questions about it. So we've spent some time over the last day or so speaking to the Minister's office and to the department in terms of getting this right. So it is $5 billion over 5 years. The three themes that are in the budget have been better access, better quality of care, and better ageing. It's true to say that most of the funding in the $5 billion you will have seen in previous years in the forward estimates. The way they've actually done this is 3 billion of the 5 billion is roughly tied up with the natural growth that occurs in the aged care approvals round. And you will have seen all of that this year included in the budget as part of the aged care package. What they've also managed to do is there was $2 billion that would have been under expenditure. And it's not because it's ACFI funding or anything like that. The under expenditure is based on the estimates they put in around the timing and the number of provisionally allocated places that are going to come online in any 1 year. What they are saying is that they overestimated that based on the time it takes to build and put them online. And so they have retained what would have been an under expenditure rather than having that funding returned to consolidated revenue. So this is not what normally happens. What we would have seen last year in the MyEFO statement would have been what we would think of as a clawback of $2 billion. What the ministers have been able to do is actually to retain that funding, and that's largely how they have funded the other elements of the package that we're going to go through. Now, the other thing that they've done, which enabled them to retain the funding, is that they've consolidated residential and home care budget lines within the aged care special appropriation. So aged care is funded through what's known as a special appropriation, which is demand driven. And they have separate lines within the appropriation. Generally, you can't move money between one and the other line. The way they've done this now means that residential and home care is consolidated, and so it provides greater flexibility in terms of how demand is met, and we know that demand for home care is increasing. But really importantly to note is that because it is demand driven, there'll be no beds that are already in the system or new beds that come into the system that won't be funded when they're ready to be operationalised. So people will still have access to residential care. And the other thing that I was checking this morning, based on some of the conversation over the last day or so, is that the ratio that we have of 125 places per 1,000 of the population 70 years and over will be met. So that means that the 78 residential care beds, the 2 restorative care places per 1,000, and the 45 home care packages. With these changes and the additional expenditure going into home care, this ratio and the elements of the ratio will actually be met. So I wanted to address that right up front, because a lot of the queries we've had over the last 24 to 48 hours since the budget has been around the $5 billion and how that works. So I hope that clarifies that, and I'm really happy at the end of the presentation to return to that and to take some questions on the specifics of that. But what I do want to do now is focus on some of the individual elements and share with you the information that we have been able to find out over the last little while since the announcement. So obviously the biggest ticket item, and the one we saw all of the media on in the lead up to the budget, was around an additional $1.6 billion to support an additional 14,000 high-level home care packages. They'll be level 3 and 4 packages, and that'll be in the system by 21-22. That's additional to what they would have been doing anyway. The process, we asked the department yesterday around how they'll actually be flowed through the system, and there wasn't a specific response to that yesterday, and that's what I would say. There's still a level of detail under some of these initiatives that we need to work through. While on one hand that can be a little bit frustrating that we can't get our questions answered straight away, it also gives us an opportunity as your representative body to influence how those things happen. Sorry, I've just been advised that we're having some trouble with the PowerPoint, so we'll just try and rectify that so you can see it. Okay, so let us know now if you can't see it. Do I need to go back over? We're all good to go. I apologise around that. Do I need to go back over any of those points? I hope not. I hope that the explanation was clear. But if you need to see the slide, you can now see the budget overview, which basically just goes through. It's $5 billion. $3 billion was already in the forward estimates for our natural growth. $2 billion was under expenditure, which the government have managed to stop from going back into consolidated revenue. They've consolidated residential and home care lines within the special appropriation for greater flexibility, but this doesn't mean, it does mean that when your bed's operationalised, you will still receive the funding for it. There is no risk of that not happening, and the ratio of 125 places will be met. And then we were on to the home care packages. As I said, $1.6 billion to support the 14,000 by 21-22. They will be level 3 and 4 packages. The process we have not yet been able to, it will go out through the natural process of putting the packages out, but exactly how that will look, there wasn't a lot more detail on, so we'll keep working on that one. The other announcement that occurred as part of the budget package, which usually doesn't, it's usually in the forward estimates but not part of the package, but this year that's been put in as part of the package, is the aged care approvals round. So there'll be an additional 13,550 residential aged care places, 775 short-term restorative care places, and 60 million in capital investment to support new places, which is the makeup of any ACAR in any year. It will not be advertised until the 18-19 financial year, so we won't see anything pre-July. And the Minister has not yet given an indication of what the actual time frame for that will be. So that will be another one that we'll continue to keep an eye on. Look, there was an additional capital vote in the package, which is 40 million over 5 years for rural, remote and regional providers to largely undertake things like building improvements or maintenance and infrastructure that they often don't have the funds to complete. The process for this is yet to be determined. It won't apparently form part of the aged care approvals round. It will be a separate process, whether that will be an open round at a given point in time, or whether it will be more like they manage the NATSI flexi arrangements where it's throughout the year, is yet to be determined, and we will keep an eye on that one and let you know about that as we hear more of those details. The other really important part of the package in terms of the aged care approvals around is the government has announced its policy intent to allocate residential care places to consumers rather than to providers. So it's like what they've done with home care in 2015. This was a recommendation from David Tune's legislated review of aged care, and the government's picked that up. And the government has actually said that this budget package is their response to the Tune review. Whether or not they go further and do other things will be our job to make sure that they do, but at this point in time, this is their response. Now, in terms of announcing this, the government haven't put a time frame around it. You'll probably recall from the Tune review that he said that it would take 2 years. The consumer groups are keen to see it happen in 2 years. We suspect that this is going to take much longer. So we were really pleased to see that what the government has done is allocate $300,000 in next financial year to undertake an impact analysis. And that impact analysis is going to look at what are the complexities, what are the risks, and how would you implement it if the policy intent is to be taken through. Now, it's important to note too that the policy intent was an in-principle policy intent. So if through this process there are concerns or issues that come out, the government may choose not to do it or to delay it further. So they're going to look at it from the point of view as us as providers, and importantly, they're acknowledging that this might work differently in metropolitan areas than it might in rural and remote areas, and I think that's a really important thing for us all to note. They're going to look at it from the point of view of the consumer, and they're also going to look at it from the point of view of the financial sector, which is absolutely critical in terms of building beds and making sure that providers have access to the funds that they need to continue to deliver those services. What we've been stressing in the conversations with the Minister's offices and with the department is it's fine to actually make a policy intent announcement, and we do want them to do this work, but what will happen is there'll be some uncertainty in the system now about whether or not providers are going to want to invest. So we've certainly been stressing with them that what we're going to need is timing and certainty around what's going to happen and when it's going to happen as soon as is practicable. But having said that, we think doing this impact analysis statement first is actually an important part of the process. And I think what we were hearing yesterday was they'll be looking at how we're involved in that over time. The next initiative is the Quality Care Fund, which is $50 million for residential care providers over 2 years from 2018 to 2019, and it's going to support the transition to the new standards. Some of you may not have missed the fact that that $50 million looks a little bit like the amount that we would have got had we not had a complex healthcare 50% indexation freeze. I'm not going to say any more about that, but that looks to me like something that they've done, and we'll be watching to make sure that there's not onerous requirements around its use, and that you can use it to support and give you some additional financials. I know that it's not a huge amount of money, but I think it is some recognition that there is financial stress in residential care, and that people need to have some funding to address some of that financial stress. We'd already seen the announcement of the Quality and Safety Commission ahead of the budget, but just to recap that, because it does still form part of the package, and there were a couple of extra little bits in there that hadn't been announced. So we will have the Quality and Safety Commission, which we headed up by a Quality and Safety Commissioner. This commission will subsume the current Aged Care Accreditation Agency, the Complaints Commissioner. They'll go into the new commission from 1/1/2019, which is when the commission will really start operation. The department's compliance roles will come into the commission, but that won't happen until the 1st of January 2020. There is a new Chief Clinical Advisor position that will form part of the commission. One of the interesting things around the way the government's done this is in the original Carnell-Patterson report, there was a recommendation around also having a consumer commissioner. They haven't done that. They've created one commissioner. I think the question for us now, and what we'll be looking to work through with government as they get ready and they've settled the structure underneath, there's not a lot of detail underneath this, ready for it to commence operations in January next year, is making sure that in however this is done, there is still procedural fairness and natural justice for providers in this process, because a lot of the spin around it has been around how it's there for the consumer. That's well and good. Most of us would recognise that that's an important element, but there must be, in the way that this is rolled out and in the structure underneath, enough guarantees for us that there is procedural fairness and natural justice for us as providers. The other things that had been announced previously were around the Serious Incidents Response Scheme. There's no details around that, and there's going to be a consultation process around that. There's also the announcement around the risk profiling approach, which will determine the frequency and the rigour of the unannounced site audits. And so that will be something to work through as well. And it will be good to have a clear understanding of what the risk profiling is, so that we understand why they may be turning up on our doors and when they are turning up on our doors and how frequently they are turning up on our doors. Importantly, which hadn't come through in the announcement before the budget, they have now confirmed that the unannounced visits levy has been deferred until 1 January of 2020. We have been instrumental in our advocacy in making that happen, and what this means clearly is we have another 2 years to see if we can get the government to accept its responsibility for undertaking its own compliance functions and leave us to contribute to the cost of the continuous improvement system. Also, with the Quality and Safety Commission, the announcement highlights that there'll be performance rating of providers on My Aged Care. We knew that was going to happen. There'll be a comparison tool. What we're hearing from the consumer groups is that the method that the consumers actually prefer, rather than a straight star rating, is more like the UK approach, which is a traffic light approach. So there's kind of, these are things to be concerned about. These are things to ask additional questions about. These are things that, are good to go in aged care. So there will obviously be a lot of work between now and when that gets up that we'll be contributing to and working with you and representing your views as members on. They also announced in the budget that they will look to simplify accreditation reports, plain English. That won't go astray, not just for consumers, but probably sometimes for us as providers. And there'll be a combination of that on the website, so a simplified report as well as the consumer experience reports. Now, I know there are some concerns about the consumer experience reports, particularly in the way they engage with people with dementia, and some concerns about how people will read the reports. So clearly, in looking at these things over the coming months, we'll be looking to make sure that they make sense and present fairly and within a context around what's happening in an aged care home. There's also been the announcement that a single Charter of Rights will be developed. That's a flow-on effect, I think, from the single standards that have now happened that will be across residential and home care. The other announcements on Tuesday night that are slightly different from what we've seen before is there will be an open disclosure framework, and the aim is to encourage discussion by providers of adverse care incidents with residents and their families, and also that providers who obstruct complaints resolution, which will be a very extreme end because I'm not really aware of many or any providers that do that, but to the extent that that happens, there is an intent to publicly identify those providers on My Aged Care. There has not been more detail around that at this stage. I was talking to the department this morning, and they are saying again there will be a process to work through what this looks like, when it will be applied, what sort of information will be provided. So it's going to be a busy period between now and the start of the commission. The other little thing in the budget that we know there's been a lot of discussion about, but we hadn't seen that it would necessarily come in this year's budget, but I think it's linked to the announcement around the intent to open up residential care more and provide the beds to consumers rather than providers, is that they are looking to shift the cost of the prudential risk onto the industry. So the levy will now be compulsory and retrospective. It will be where any defaults in one given financial year exceed $3 million. So it won't be able to happen till the end of the financial year. They don't have details underneath. We've asked them the questions: is it going to be flat across the industry? Is it going to be proportional? Are there going to be exclusions for small providers? We've made the points that we made when the consultation was happening about what you wouldn't want to do is have pass on costs of prudential risk and create more insolvency for providers who perhaps are marginal or struggling financially. And we've been stressing that as the financial challenges and number of providers who are operating at a loss is increasing, that heightens the risk of passing that on. We've just completed our response to the EY report on Prudential. That'll be coming out to you soon, and clearly we'll be able to use that to help develop the details, and we'll be interested in your views around the recommendations that we want to make around that. So we'll work with our divisional councils and all of our members to make sure that we're giving very good and clear advice to government. The other thing that was in the budget package was strengthening the prudential standards. So we don't really have much view other than what's already been in the EY report around what that might be, and that'll be one that we'll be continuing to work through. Also, there was funding to improve the capability of the regulator, and I guess to the extent that what we really need for them to do as a regulator is to intervene before there are collapses so that there aren't levies needing to be made. We would want to see that investment, because otherwise, you know, if they've fallen down on the job as a regulator, that's not a good outcome for us as industry. So again, a lot more work and not much detail underneath that one. But I have spoken both to Minister Wyatt and to Minister Hunt's Chief of Staff around this one, and they've said they'll work with us around what that will look like. But it is an additional cost that will be passed on to the industry. And we've also been clear that most likely what that will see is a cost impost passed on to consumers. I think that's why they've made it retrospective. So that'll be another one for us to work through in terms of how we deal with that as providers. Now, My Aged Care is going to receive an additional $61.7 million over 2 years from next financial year. They're going to look at providing some self-service options for consumers. So that might be around really low-level assessments or other elements. So we wait to see exactly what they will be. They'll be making some website improvements and looking at service finder functionality. While we're all incredibly frustrated with My Aged Care, it's a good argument for them to have put some additional money in, and we'll be trying to watch and advocate and make sure that it actually does make the improvements that it needs to make, so that it's easier for us as providers and easier for individuals who are using My Aged Care. The other pilot that's in there is a system navigator pilot, $7.4 million over 2 years. So this is actually going to, hopefully, it's small in its trials, and we might argue that it should actually have just been implemented more widespread, but at least it gives us an opportunity to look at how this might work. It will provide now some face-to-face support for individuals who are using My Aged Care or who are not using My Aged Care, because they're not going to ring a call centre or go online. And it will include outreach, which will be important for those organisations who are servicing homeless people, etc. They're proposing 30 aged care information hubs around the country. So this will be places where people can go to talk to a real person about using My Aged Care and getting through the system. They're proposing 20 community hubs. The difference between those is the community hubs will be where groups of consumers, I guess, you know, peer conversations and discussions can happen to support each other. And there will be 6 specialists offering one-to-one support for vulnerable people. So this will be for LGBTI, you know, homeless, called people who have special difficulties in using My Aged Care, and they flag that these positions will be with groups like, I'm imagining, they haven't said these, but with consumer groups. So you might imagine that an organisation like FECA or a Migrant Resource Centre will be the people who will pick that up and run that to support vulnerable groups, and obviously Indigenous communities as well. I'm hopeful that this will relieve some of the pressure that providers have at the moment, because in those areas, you know, Indigenous providers will tell us all the time they're the ones who end up ringing My Aged Care because the consumer won't. Hopefully this will provide some support, and what we'll need to do is make sure that we've got information from the pilots that see that more widespread, so that the load is lifted off providers who are currently doing that without really any resourcing. They're also adding 6 financial information support officers to DHS. Their focus will really be where there are complex financials that need to be worked through for any consumer that holds up means testing. So hopefully they will show us a way that we can make My Aged Care, you know, more effective, more effectively operate. There was an announcement around assessments. So there'll be a new assessment framework. 14.8 million will be done to design and implement a new assessment framework, and there will be consultation on the design of that. I think more important than that is that there was flags in there that there will be a new national assessment workforce from 2020. This will combine the ACATs and the RASs, which we've all thought should occur. Originally, it was supposed to happen by 2018. That got kicked down the road a little bit with the rollover of CHSP, but they're now flagging they will do that by 2020. Another little element that's not 100% clear yet, I'm seeing some questions come in. I do think what I'll need to do is get through the presentation first and then come back and answer those. So bear with me, but it's good that you're putting the questions in so you don't forget them by the end of the time. The other little assessment one in there is around a revised reablement assessment model in the CHSP program. They're going to trial that in 4 RAS sites and undertake a national evaluation. I'm not sure why we need to trial that again, given that it works really well in a number of states already, but at least it's forward movement from government nationally around how reablement can be assessed for and how it can be rolled out in the system. There were a grab bag of initiatives that will, I'm sure will bring us some useful outcomes. So 32.8 million over 4 years for new models of palliative and end-of-life care. No more details around that. 20 million over 4 years to trial a nurse-led community mental health model to reduce social isolation. That's funding that will go to the Australian College of Mental Health Nurses, and that's the amount of detail there is. The department can't tell us more about that at this point. The one that we're pleased about, again, it's relatively small, but it is a forward movement, 82.5 million over 4 years for mental health services for residential care. Rather than delivering that through the MBS, there's been a decision to deliver it through the PHNs, and I understand that's of particular ministerial concern, that this is not just about funding doctors. So I think the PHNs are being briefed on this, and we'll have to look at, there'll be some kind of open round, given the amount of money is not going to be national. I'm imagining there'll be some kind of open round, and a chance to see how this will work. It's an important principle that people in aged care services need to have access to the same mental health services, so we'll be very influential in working on that one hard. Then there was 5.3 million over 4 years on technology solutions for people living with dementia and their families, and 300,000 over 2 years for the hip fracture registry. Hip fracture seems to be in there every year. Then there was another grab bag of better ageing, what they called better ageing. So 22.9 for sporting organisations. It'd be a grants program for sports and exercises specifically designed for older people. 6.5 million over 4 years for 45 and 65-year online checkups. So I've unfortunately missed out on a 45-year checkup, but if I'd had one, it would be around health choices I might be making to try and limit risk or minimise the impact of chronic disease. Working options, because we know that discrimination in the workplace starts from 45 years of age. So for those people who are in that situation, that some new services also announced elsewhere in the budget around career transition assistance and skills checkpoint programs. And also at 45, have a look at superannuation and other assets to see if you're going to be able to set yourself up appropriately for your retirement. And then at 65 years, there'll be a checkup that helps you prepare. I guess they've called it an active longer life, but really that really is about how you're preparing for retirement. So this package has been called More Choices for a Longer Life. That's kind of the content that we've got at this point. There's lots of more detail that needs to be filled in, and we'll be working really hard with the department and both ministers and their staff to do that over the coming months. But I think what you can see in what the government's done in the budget is it is largely a continuation of the roadmap for reform. It does follow on. There's been a fairly consistent bipartisan and continual movement around reform in aged care, starting with the Living Longer, Living Better package that Minister Mark Butler instituted as when the ALP were in government in 2013, through increasing choices, which was the 2015 budget that you will remember from the coalition government, and now this one. The government's been clear that this package is in response to the legislative review, and it's their response at this point in time, so they're not ruling out that there may be other adjustments, and we are working hard with COTA, the Guild and Laser on some of the user pay issues that might help us to increase some of the revenue in aged care in areas where people have capacity to pay. But we do still note that even though it's moving down this path, it's on a line, and it's still moving in the same direction. We do know that there are competing policy agendas, and I think we're seeing that sharply at the moment with the government's desire to increase user pays. So even though they haven't done anything specific about that in the budget, it has been for some time that those with means pay more than those who don't have means. But sometimes that's butting up against what's regulatory and compliance action around additional services. We're actively discussing this issue with the department as well, to make sure that we get some clarity around the whole additional services, specified care and services and extra services piece. And so given that we're still going down a particular path, we will determine now with our members and with our divisional councils what our advocacy priorities will be for further change to put us in a better position. We know all of this needs to be done, and the absolutely critical issue facing us as an industry is the overall financial sustainability. So we'll be looking at all of those things through that sustainability lens. We've been very active, and I think the 50 million, while it's a very small initiative, I think that's in there because of the advocacy work we have been doing off the back of Stuart Brown, which is now highlighting, 41% of people, of providers operating at a loss, 56% in rural and remote areas, and we know that that figure is getting worse and that there's real issues out there. So small, but some acknowledgement and a lot more work to do, and everything we do over the coming months will be through that sustainability lens, but we will continue to look at supporting the implementation of these new measures, addressing the ones that we don't think are good to minimise their impact, and making sure that we get the best outcome we can, but also looking at what other things we need, particularly around sustainability. So look, that's all I wanted to cover in terms of my presentation. There are already 12 questions, so if there are other questions you want to ask, please send them in now. But what we might do is go back through, and I'm going to open up the little folder so I can see. You'll get me back on the screen, and I'll start having a look at what the questions are that you'd like me to address. So just bear with us while we move over to that. And we'll start answering the questions. Hopefully now you can all see me. And the Q&A looks like it's down the side. Is that right? Okay, so Fiona, you did see the slides, so that's good. Yes, we can make the PowerPoint available to people after the presentation. There are a couple of questions around that. One question from Samuel Murray: do we know the yearly breakdown of the 14,000 level 3 and level 4 packages when they come online? No, we don't. We asked that question specifically yesterday, and they haven't been able to tell us that. That's more detail we're chasing. Samuel's also asked us for what? Home care? Sorry, I've just been prompted that in year one we've been told that the number of level 3 and 4s will be 8,000, but we don't have them for the out years. So we'll get more information about that. There is a question about what's the COPO indexation for 18-19. That's a very good question, and we'll have to go back on that one. There was no information about that yesterday. Lisa Rouse, hi Lisa. Is the 50 million Quality Care Fund restricted to residential aged care? Yes, it is. And no, I haven't heard anything around home care CHSP providers transition, and you can rest assured that's one that we will take up. Samuel's made the comment, which perhaps I'll do my best, Tony Jones, and so I'll take it as a comment and maybe agree with it. It does seem unbalanced to spend $300,000 on reviewing residential care deregulation while we're giving $6.7 million for my aged care. Good point. I'll take that as a question, as a comment, sorry. Samuel also had one here that was 61.7. I'm not sure what that relates. Perhaps you've answered your own question. If you want to send us a message so I know what that one is, I can come back to that. Tom Godfrey, hi Tom. You're just interested in whether or not this package will form an exhaustive response to Tune, or whether further responses will come. They haven't actually ruled out making any further responses. They've said this is their response at this point in time. The conversations we've been having are around things like, are they going to uncap the basic daily care fee, which was in the legislative review, Tune review. They were clear they weren't going to do any of that in the in this year, in this budget, but they left it open that they will look at it in terms of MyEFO. They're wanting, you know, support across the board. They need bipartisan support for these things. We know the government's seen, and I think part of the reason such a heavy focus on it being the baby boomer budget is because the government has been seen by older Australians not to be on their side. So I think this budget is actually around trying to correct that. I think that's why there was squirmishness around doing anything that would increase now what people are paying, but we will keep on that because this is a way of, as we said, in some areas where people can afford to pay, increasing the revenue for aged care. Lisa Ralph has come back again. Could you please confirm if there was any reference to compulsory charging of the basic daily fee in home care packages? No, there wasn't, Lisa, so haven't seen anything around that at all that would indicate there's going to be any change from current practice. We can check on that, but otherwise, no. Tom's got another question. Which is what happened to the financial year 18 ACAR round. I think the answer is they've not had one, and we're just having one in 18-19. So that's potentially contributed to the save. But they are still saying that the ratios will be hit within the time frame that it said. So that increase to 45, the decrease to 78 for residential care and the 2 restorative care. Where and when do you think we'll get an idea as to where the home care packages will be released? Krish has asked. We've asked the question of the department and we'll follow up. So I don't know exactly when we'll have that, but we'll keep that up and share that information as soon as we can. Do we have any indication as yet as to the amount of ACFI increase? I think that is also the COPO indexation question in another way. Correct me if I'm wrong, David, but I think that's it. We don't have what the COPO indexation will be, noting that there's a 50% pause on complex healthcare that we'll still be dealing with, that we think the Quality Care Fund, you know, tries to address. Craig W, can I unpack the 146 million allocated to improve access to aged care in rural or remote areas? I might come back to that one. I need to find the fact sheet. There's not a lot more detail around that. If I can't answer that on the anymore, but I'll let you know what we do have. Susie, can you tell us more about the ratio for placements? I'm not sure I understand the question, Susie. I might need you to, if you can type back in, if there's something else that you can do that will help me answer that question. Dennis, hi, was the ACFI indexation freeze only applicable to financial year 18? The freeze was applied in a couple of ways. So there was a blanket freeze, and what we've got for 18-19 is just the 50% on the complex healthcare. And that's for 1 year. So that's for the 18-19 financial year. Then indexation comes back on. An anonymous attendee has asked, what year will the first additional level 3 and 4s be released? As we've said, we believe there'll be 8,000 in year 1. We don't have any more detail about how many in the subsequent out years. And we will continue to monitor that and get information as we can. Mahfouz Hussain, are all 13,000 new residential aged care beds to be allocated in the 18-19 ACAR or spread over a number of years? The 13,550 is for the 18-19 financial year. I'm not sure where you're saying you've seen conflicting reports on this over the last few days. I'm confident that, I mean, when government announces ACAR in any circumstances, they usually, it's a 1 year figure, so I wouldn't be concerned about that. We can double check that, but my read is that it is for the 1 year. It's a similar amount to what was provided last year, as is the transition or the restorative care beds. So there doesn't seem to be anything strange about those numbers. Samuel's said, oh, thank you, Samuel. He said that the 61.7 that I asked him to type back in for was a typo correction, so we don't need to worry about that. Samuel, I'm not sure about this question. Samuel's suggesting that the 8,000 packages to be released in 18-19 would seem to consume more than 1.6 over the four-year forward estimates, unless level 1 and level 2 are absorbed. I'm not 100% sure about that. So perhaps what we can say on this is we will try and get some greater some greater clarity. I don't believe level 1s and 2s are being absorbed, but they are focusing on level 3 and 4s because that's where the demand is. So I'll try and clarify that for you. David, any indication of additional changes to the ACFI? I assume you're meaning no, not at this stage. And of course, we've still got, as we know, the University of Wollongong RUCS study is continuing at this point in time. And I don't anticipate that we'll see any changes until such time as the outcomes of that are undertaken. ACFI expenditure is now coming to trend with where government had anticipated by making those indexation and other changes. It's actually why it was really important. We thought that they didn't put any money back in as indexation. Our concern around them doing that was that if the budgets had started to blow, they would come back and claw it back out the other side. I think the 50 million in the Quality Care Fund at least means there's certainty that that money stays in the system. Hello to all of the people at Amana Living. The question here is, are the 14,000 home care places in addition to what would normally come out each year to meet the ratio? That's my understanding, that it is additional. Yes. David's asked, same question about whether 13,500 resi care places are in 1 year across 3, so I think we've dealt with that one. Is the move to licences being allocated to consumers signalling the end of bed licences? Yes, in effect it means that instead of the licence being allocated to a provider, it's allocated to a consumer. So that is what it is indicating, and that's why I think the feasibility study is really important. It's a fundamental shift that needs to be thought through very, very carefully indeed, and all of the implications need to be considered, which is why I think it's good that there is a feasibility study. Krish has asked, will the home care consumer get a letter of an offer of package and still have 56 days to action it? I didn't see anything in the budget papers that would change that approach. We were hopeful that they might shorten the 56 days to 28 because it does actually create lags in the system, but I have not seen anything at all that would indicate that that's going to change. Another question around package care funding. Nothing mentioned about outstanding package care funding being recouped. No, there's not. So they're not going down that path. The Tune recommendation has mentioned income testing for CHSP, but no movement as 2020 fastly approaches. Clients will be tested and converted allegedly to packages. They've left aside anything around fees and income testing at this point in time, and this is work that we'll continue to advocate around for my EFO or further action. I think the timing of the election is now going to be critical in terms of when they might do anything around user pays. We've told them that the unspent funds in packages is actually still an issue and important that they look to address those. At this stage, though, they're not doing anything around that. Any more details on the Quality Care Fund? Will it be automatic? No, we've asked those questions. David's asked that question. We've asked those questions. They can't give us any more details about that at this point in time. So as I said, there are a number of initiatives that there's not a lot of depth underneath yet, which can be seen to be frustrating, but also gives us a good opportunity to influence how that works. Suzanne from Don Leonard has asked 125 per thousand. I'm not sure what the question is there. That's the ratio. That's right. So it's 78 residential, 2 restorative, and 45 home care. And where the department have been confirming this morning that with the changes that they've made, that's the ratio that they will hit. They've said they think they may hit it faster than the deadline. Let's wait and see. An anonymous attendee has asked about CHSP growth rounds and their lack of them. I think that's a good question, and it's one that we have asked and we have not yet had a satisfactory answer to. So at this stage, there's no indication of a further growth round, and certainly that's something that I think the opposition will probably ask at the budget estimates hearings, and we will continue to raise that concern as well. So another person who's not familiar with the aged care sector has asked a question. A person who works in the Department of Environment's asking whether the risk profiling for providers that the new commission will do will have anything in there around managing extreme events or protecting clients and services from natural disasters. I think that it wouldn't be so much in the risk profiling. There are other requirements that providers have to meet to do that, and it would be assessed in that capacity through the standards. I don't think the risk profiling would necessarily pick that up, but there is work to do on the risk profiling, or it won't pick it up separately from the work that's already in place that providers have to meet. There's another question here about whether the 40 million over 5 years for rural providers for building and infrastructure improvements would cover disaster preparedness resilience. There's nothing specifically indicating that, but I imagine some of the expense that those services would have will align to or be addressing impacts that disasters may have had. Thank you for your questions. I hope that's answered those. An anonymous attendee has asked whether that considering new home care package clients are outstripping exited clients by 31%, these new packages will make little inroads to the 100,000 people waiting. Look, it's fair to say that when you've got a waiting list of over 105,000 people and you put 14,000 additionally in, it's not going to go all of the way to do it. I think that's true. So I don't think in any way this should be seen that we're going to stop pressuring them to make even more investment into home care packages. We all know that it is needed. But I guess the 14,000, the best we can say about the 14,000 is that it is a start. Another anonymous attendee has asked if there's any mention of staffing ratios within residential aged care. There was nothing in the budget. I think that we might see, obviously, the ANMF campaign is still running, and in some spaces now they're talking about staffing more broadly. That's going to continue to run. We'll continue to talk about the issues associated with that and why we don't support ratios. ACSA was in Canberra for a couple of days. We've met with a number of key politicians around this to talk to them about why staffing ratios, are a problem. But there's not been any mention in the budget. I think that what will happen is when the aged care sector task force releases the workforce strategy, I think there might be more discussion around it again there, and clearly the unions are ramping this up as a election campaign issue, and it's one that we will continue to address. The next question from Steve is about details around the community hubs in terms of location, opportunity to tender. No, it's another one, Steve, where there's not a lot of detail behind what's already been announced. We did ask, but there's not a whole lot more there at this point in time. Tom Godfrey's asked about whether or not we think government will act on the higher home care funding level, the level 5 that was recommended. They haven't acted on it at this point in time. I don't know for sure, but the point that we've made to them is, while we wouldn't mind a level 5 home care package if there's more funding attached, it doesn't really matter whether there's 5 package levels or 4 package levels. What matters is actually the amount of funding that government's contributing to those. And what we wouldn't want to see happen is that we end up with an ACFI style system where we've got, 64 home care funding level packages necessarily. So I think they haven't done it. I don't know whether they'll look at it in future, but we would be saying what's really important in terms of looking at how you support home care is what's the maximum subsidy you're prepared to pay to support someone at home, whether it's called a level 4 or a level 5 package. I hope that answers that one for you, Tom. Hi, Graham Reid. Graham's asking the question of whether or not there's been any recognition of the need to increase the lifetime cap on fees and charges as a means of addressing financial sustainability. No, there hasn't been any specific discussion around that, Graham. And as I said, they did indicate in the lead up to the budget that they wanted to look at user charging outside of the budget context. Indicated my EFO, but I guess the timing of the election will now come into play as to when they might look at anything around user charging, including lifetime caps. But, rest assured we'll be keeping on that bandwagon, because there's only two ways to fix our funding sustainability. One is by government investing more of its taxpayer funding to do that, and the other is to increase the amount that individuals are paying. So it's absolutely critical, and we'll be working hard on that. And we will do that across the board. We will also work with the Aged Care Guild and with LASER, because it's a very important right across the industry issue, sharper in some of our not-for-profit members than in others, but one that we need to see addressed right across the system. Question here about whether or not the 18-19 will be the last ACAR round before deregulation. We would resist that. There's no dates been provided for when that might happen, and I think what we can take from the measure is they want to see the outcome of the feasibility study before they make any decisions around what the timing will be. David Toon's review recommended that it be 2 years. I'm waiting to see what the feasibility study says about that. I feel 2 years may still be too quick, but we'll have a look at what comes out of the feasibility study. So no, at this stage, I wouldn't expect 18-19 would be the last ACAR, but we need to keep an eye on that one. Another question from an anonymous attendee is whether the focus on level 3 and 4 home care packages, is that likely to be due to the Commonwealth Home Support Program and Home Care Packages integration proposal, which of course they haven't actually enacted at this point. I think the focus on level 3 and 4 is purely because that's where all the demand is. So if you look at the wait list data, people are waiting for level 3 and 4. A number of people who've been assessed as needing level 3 and 4 are getting lower level packages, which blocks people who've got lower level needs coming into the system. So I think it's purely based on demand. We've asked the question yesterday about whether or not the fact that they've merged home care package and residential care funding in a special appropriation would impact on them looking at merging CHSP and home care packages. The answer to that has been no, and the initial indication that they're still looking at doing that has been the announcement in this budget that they will look at the integration of the assessment workforces by 2020, but we still really haven't seen a lot of indication of action on merging the CHSP and home care package program. Another question here from Krish, and I'm conscious of the time. We're almost running out of time. I don't think there's a lot of questions left to answer. Will the unannounced quality levy replace the accreditation fee we pay to have an accreditation assessor visit? No, it won't. It's funding for you to support meeting the changed quality standards. Kenny has asked whether the CHSP service providers are able to access extra funding to address the evaluation of the wellness approach. It's unclear exactly what shape that will take, but it didn't look to me like it would be funding for individual service providers. There'll be pilots, so there might be providers and RASs involved in those pilots, but then the evaluation would look to me to be done centrally. But what you would hope the evaluation would also look at is whether or not there are changes that might require funding adjustments. As you've said in your question, maybe there's more documentation required as a result of a wellness approach. These are the sorts of things that we would want to see come out of the evaluation so that we know how the funding and structure of any more permanent changes or more across the board changes would need to be addressed. From R. Kennedy, will the financial information support officers replace the work of financial advisors operating privately in the general community? Gee, I don't know the answer to that. I wouldn't think so. I think we can all experience that DHS is not generally helpful in terms of supporting people to work through that. I find it hard to imagine that by having 6 in the system nationally that would replace financial advisors, but I guess it may have an impact in making some of the information clearer. Well, the one thing I've been remiss in not mentioning is we're going to have a forms task force, which sort of fills me with dread really that a task force is going to be able to simplify the means testing forms, but nevertheless it is an attempt to and an acknowledgement that they need to streamline the means testing forms and make it easier for people, particularly people where there's not complex financial arrangements. So I think that's a good initiative, but I don't necessarily think that you're going to get a streamlined, simpler form by having a group of people sit around and look at that. But nevertheless, we'll support that because we all know we need much simpler forms for people to fill out, much more timely responses from DHS in terms of undertaking that means testing. And hopefully if the forms are simpler and consumers can actually fill them out more quickly, get them in, and the DHS can process them, that's important. The other thing I haven't mentioned is there was funding in the budget, 100 odd million plus, around the modernising the aged care payments system. Not a lot of detail about what that will be or when aged care might get off the bat, but we did notice elsewhere in the budget that there's also a decrease in DHS staff, and we've got some follow-up work to do there because we all know when we've got problems with DHS we have a lot of difficulty in getting the answers that we need. I think this next question from Krish about does that mean there will be no ACAR in 2017-18? That's my understanding. So they've skipped a year, which is not good. Martin Samet, hey Martin, how are workforce issues being addressed in this budget? They haven't actually done anything in this budget, but I think they're waiting now for the workforce strategy task force to report. It's due to report by the 30th of June. Some of you will have seen, and I think the presentation's up on the web now, John Polair's presentation, which outlines the areas for strategic action, and clearly this is an issue that we'll continue to address. And I hope that everyone's seen that we have now at ACSA created a workforce and industry development unit directly in response to, along with sustainability, the workforce issues we're facing as an industry are enormous, and we want to increase our focus on that and in supporting you as our members to actually make sure that you can recruit and retain staff, pay staff. There are a whole range of workforce issues that we'll be working on through that unit, and there'll be more and more information coming out about what we're going to do in that, and we're looking forward to being able to support our members even better in managing their workforce issues. That actually brings me to the end of the questions. Thank you for those. There was a lot of them there. As I said, we've got 3 minutes left, so there's still chance for you if you do have any questions that you want to put in. Otherwise, we will take the questions that you've given us where we didn't have an answer. But it is fair to say, and I'll re-stress, we've got as much information as we can at the moment. We've spoken to Minister White's office, Minister Hunt's office. We've spoken to the department to get as much information as we can. And at this stage, this is the maximum information we have. We will, through our ongoing advocacy and discussion, be getting more and more information and sharing that with our members through our ACSA Weekly and special bulletins, as we can. So I'm going to have a look and see if did any more questions come in there. No, I don't think we've got any new questions. Just checking before we finish up. Oh, thank you very much. Some people have sent in and said we've done a good presentation. Thank you for that. And we might look at, I think this has been popular. We've had a lot of participants. We'll look at perhaps doing some updates as more information comes to hand, but we will do that through our written information as well. So thank you all for your attendance this morning. And I think some of you may have heard early when we were setting up, you might have heard some of our setups. So thank you for bearing with us through those as well. But hopefully it's worked well. We'll make sure that the presentations are available to people and look forward to working with you and seeing you at our various events over the coming weeks. Thanks everyone. Have a great day.